Welcome back to another episode of Spilling the Tea with Dr. Hendrix
And Gabriel D,
and Lava Lee.
who is taking a nap. So Lava Lee will be back with us on a future episode.
She's reading books for now.
Yeah, and you can too. We're
Yeah.
going to recommend a few here and there. So today, beyond the topic of recommending this book, we are going to discuss a very important, in my opinion, topic regarding sexual health.
Yeah.
It's anal sex aftercare. So the important steps you want to take to make sure that you are keeping that area healthy after anal sex.
If you haven't watched the video about anal sex, we discuss if anal sex is safe. And today we are talking specifically about the afterwards.
Yeah, and so that aftercare is essential for maintaining a healthy sex life and to ensure you reduce any risk for discomfort or anatomical damage. And we're going to get into all those steps
Absolutely.
and what's going to be best to keep that area healthy and ready for round two.
And so what are the steps to take immediately after anal sex?
So after sex, you want to take a moment and relax, enjoy your accomplishments. There's no rush to get up and get things taken care of. Of course, once it's time to get things moving, you want to cleanse the area.
Yes.
You want to really focus on making sure you're using a very gentle or mild soap. This is a big thing that people may not be aware of, but a lot of the soaps that we use for body wash can be very damaging to the skin, especially those sensitive areas. So use a very mild soap to wash the area. Do not use any harsh, scrubs or any type of cloth that's going to irritate. Just gentle as possible, avoiding any type of irritation to the area. Of course, after anal sex is going to be the most sensitive time, and so you don't want to cause any irritation that can further result in damage or make it difficult for you to be ready for that next round.
So relax, take a shower with mild soap.
Exactly. And of course, that's going to be the goal, to reduce any bacteria that may be present, which bacteria is all over the place, all over our healthy skin. But when you've had an encounter like anal sex, you want to just make sure that there's nothing remaining that could further cause any infection or irritation.
Absolutely. Easy enough.
Easy enough.
What else is recommended immediately after sex?
Well, I'd recommend considering your hydration status. How much water have you had that day? It's a great time to rehydrate. Of course, hydration is going to be key to helping any cells that were inflamed or irritated in the lining of the rectum or the anal cavity post-sex to heal and to make sure that they repair themselves as quick as possible. You also want to consider resting. A lot of muscles are
Yes.
involved in anal sex, and so you want to make sure all those muscles have their time to rest, recover, so again, they can be ready for when you decide to repeat the encounter. So rest and hydration are key.
It's the perfect time for a nap.
Yes, it is. After drinking lots of water.
Yes, don't forget to drink water before sex, during sex maybe, and after sex.
That's true. Again, I've talked about it in the past. You can take breaks during
Yes.
sex, and if your mouth gets dry, it's a sign you probably should just grab some water, take a time out, reassess, and
Yeah.
then dive back in. And it's also a great way to prolong the sexual experience, too.
Absolutely. There's no rush.
No rush.
Are there recommendations for those experiencing irritation or discomfort after sex?
There are multiple options to smooth the anal area after sex. You can consider over-the-counter topicals. Something like aloe vera can be very nourishing and very healing. There's also other products that are specifically designed for anal itch, anal irritation. Oftentimes these are directed towards hemorrhoids or things like that. But even if you don't have any of those symptoms and you just have some irritation, those creams can be really helpful to reduce those and improve healing time. It can also be helpful to avoid any tight clothing or anything that
Right.
can irritate by rubbing or creating friction along the area. So loose, breathable fabrics are going to be the best option, especially if you're having irritation.
And is there anything to look out for after sex?
After sex, consider monitoring the area for any signs of damage to the skin or to the mucosal lining. Things like pain that doesn't improve or continues to worsen, bleeding, excessive itching, discharge, which is typically could be a color, could be clear. You want to monitor for any of those signs, as you want to reduce the risk of infection or those worsening symptoms, creating another problem. If those symptoms don't improve, you do want to consider seeking a medical evaluation. Typically, if there's any sort of infection, it's not going to happen right after intercourse. It's going to take some time. So you want to continue to monitor that area regularly, just as you would any other area in regards to sexual health.
Yes, it's important to monitor all the areas, especially after sex.
Exactly.
Are there any ways to prevent infections?
Of course, the most important thing you want to consider is using a barrier method like a condom during anal intercourse. That's going to dramatically reduce the risk, especially a sexually transmitted infection. Other bacterial infections are considered rare, but they can still happen. So making sure to clean the area again with a gentle soap after intercourse is going to be helpful. And then, of course, knowing your own sexual history, knowing your sexual status by getting screened regularly with your primary care doctor, talking to your sexual partner and making sure they've also taken those precautions is going to dramatically dramatically reduce your risk of any type of infection.
Just the basics.
Just the basics.
Are there other ways to promote healing or keep the anal area healthy?
There are some other topical or over-the-counter options you can purchase to keep the area healthy and hydrated. Things like petroleum jelly or Vaseline can be really helpful to coat the skin, encourage it to heal, keep that hydration intact. But what you want to consider is Vaseline is not the best option if you're using condoms as
Right.
a lubricant because it can wear the condom down. You want to be aware that is not a good option for you if you're concerned about STDs in regards to using it as a lubricant.
Mm-hmm.
But if you just want to use it after care or routinely to keep the area hydrated and reduce the risk for friction there, it's a great option.
Yeah, actually, I love Vaseline, especially for dry skin. I use it on my elbows and knees and my lips sometimes.
Yeah, it's a great substitute for chapstick, which is probably why my lips always look super shiny because I use Vaseline a lot. I think it's a great option for
Yeah.
maintaining hydration and health of your skin. But everybody's got their own preference.
Yeah, and I feel like Vaseline is a multi-use product you can use for pretty much everything.
Yeah, I actually use it as a deodorant, which is not necessarily for everybody. I know that some people would say that's a horrible idea, but it's one of the only few things that work for me. And so it also helps to reduce any irritation or inflammation. A lot of those over-the-counter deodorants cause a
Yeah.
lot of irritation under my arms. But other things you can use, back to this topic, instead of petroleum jelly, coconut oil can be really great. It's very nourishing and
Mm-hmm.
antimicrobial. There's a lot of vitamin E options as well you can purchase over the counter that can be applied on the skin. So vitamin E, coconut oil, Vaseline are all great ways to continue to keep that area healthy post-sex or even just routinely to ensure it
Yes.
stays hydrated and avoids irritation.
Are there food and supplements that can help keep the anal area healthy?
So consuming foods that are high in vitamin C, vitamin E, zinc are all going to be helpful to let your body repair tissues. Those are very important nutrients and key in the tissue repairing process. They're also very great at reducing the signs and symptoms of aging because they have a
Yeah.
lot of antioxidant potential. So a diet high in vitamin C, zinc, and vitamin E is always going to be recommended. Beyond that, supplements don't have a lot of clinical evidence to support their
Yes.
use in comparison to whole foods and adding them into your diet. Those are going to be a lot more beneficial for you. So I personally recommend avoiding supplements and just trying to focus on the foods you can consume that have a lot of antioxidants, vitamin C, vitamin E, and zinc.
Fruits, vegetables, all the good things.
All the good things.
And so are some important maintenance recommendations in regards to sexual health.
So regular health screenings are going to be very important. You want to consider at least every 3 to 6 months seeing your primary doctor and of course determining your risk with them. They're going to tell you, I want you to come every this many months, depending on your risk factors to make sure we're keeping you at low risk for developing a bacterial infection or any type of STD. And if you do become positive, we treat it appropriately and quickly so that it reduces the spread of the
Mm-hmm.
infection and any symptoms that you would experience. So those routine screenings are going to be essential. You also do want to tell your doctor that you participate in anal sex, specifically receptive anal sex, so that they can appropriately screen you. A lot of times a provider will assume that you only need to pee in a cup and have a blood test,
Right.
but there does need to be a swab of the anal cavity to check for chlamydia and gonorrhea. Those types of infections will not show up on a blood screen or a urine test. So again, you have to be as honest as possible with your provider so they can adequately screen you and ensure that you're staying on top of your health.
So you can get tested thoroughly.
Exactly.
Other than your doctor, who else should you discuss these concerns with?
Great question. So you want to consider talking to your sexual partners. Of course, you want to talk
Right.
about your history, theirs. This is a great opportunity for you to also get closer with your partner, express your concerns,
Yeah.
discuss things that also may be important, like consent, things you want to partake in, things you don't
Mm-hmm.
want to partake in, and then those areas that you've been properly screened for. That way, there's open communication and you can put yourself at ease knowing that if you're honest with your partner, they're likely going to be honest with you as well.
Another thing that we talk a lot in these videos is communication. Communication is always key of having a healthy relationship.
Exactly.
Are there any long-term care tips to consider?
Absolutely. So anal exercises can be useful to help keep the muscles in the perineum healthy and toned. And of course, those are really important with allowing us to have successful and satisfactory anal sex. And so you can do those exercises anywhere. They're called Kegels. They typically result in the feeling as though you are trying to stop yourself from urinating.
Yeah.
It's sort of that contraction that can occur. Doing those over and over again throughout the day, throughout the week, month, years can help to keep those areas toned again so that those muscles don't have any signs of atrophy or wasting and they can maintain your best sort of support throughout sex. Alternatively to that, you also want to consider lubricant. Lubricant is
Right.
extremely important. You want to find one that works best for your body. For some people, lubricant can cause a lot of irritation,
Mm-hmm.
discomfort post-sex, during sex. So if one is not working well with your system, it's great to just toss it. Don't keep trying that same one that's already not working well for you. So a high quality water-based or silicone-based lubricant is going to be essential. with those exercises, you'll be good to go.
There's so many lubricants out there, and
Mhm.
there are options to choose from. So if one is not working, you can try another one.
Exactly. So if you have any recommendations on lubricants that you like to use, you can leave them in the comments below. Maybe we'll give them a try.
Yeah.
Maybe someone in the audience will as well. If you have any tips for post-sex anal care that work well for you, or you've heard something through the grapevine, leave it below
Let
as
us
well. We'll
know.
address those. Or if you have any other questions or concerns regarding sexual health, anal sex, we are here to try and answer those for you. It helps us to learn more, helps us to educate everyone else out there as well that's interested in this topic.
And if you have any recommendations of different talks that we can discuss, please let us know in the comments. We're always looking, and we love that you like those videos, that you subscribe to our channel. We appreciate you watching us. And if you haven't yet, subscribe to our channel.
If you haven't yet, subscribe to our channel. We're going to say it one more time. No, we look forward to seeing you at another week's episode. So until then, see you later.
See you. Bye.
Result in damage or make it difficult for you to be ready for that next round. And we're going to be talking about a lot around rounds.
Round.